Good evening. I'm Sally, I'm 52, and I come from Nebworth in Hertfordshire, and I had stage 1 malignant melanoma last summer. Firstly, I'd like to say a massive thank you to Imogen for this amazing conference. The planning must have been epic. Secondly, thank you for inviting me to share my experience, which is from the heart, as I'm not at all medical. I do think that decision was partly made as my surname is Pickles, and yours is Cheese. We're practically a ploughman's. As a child growing up in the 60s, every summer holidays I burnt. Fair skin, freckles, and sun equaled disaster. Teenage years were spent still getting terrible sunburn. In the quest to get a colour, I tried sunbeds in my early 20s, but only a handful of times. Even that far back, the damage was probably already done. I had a convertible car in my 30s and drove around completely oblivious to the dangers. I can remember returning from holidays being told, "You're not very brown." Those words now are like music to my ears. Before my diagnosis, I never realised the seriousness of skin cancer. I knew nothing about melanoma and the fact that it can spread or just be within your body. I thought it was an easy procedure, but like many things, we often learn the hard way. My melanoma journey started around 4 years ago when a freckle on my left forearm changed and had a very small red area joined to it. I went to my GP, who was the skin specialist at my practice, and she froze it off for me. I had a huge blister, but as far as I knew, job done. The area stayed red, and if I ever went to my GP for other reasons, I always questioned the red area, but was told each time it was just scar tissue. I became conscious of it and cringed looking back now, but sometimes covered it with a foundation. I took my mum to the hospital to have a lesion removed from her calf about 2.5 years ago, and even asked the consultant in a quiet moment if she thought it was okay, and she seemed to think it was innocent enough. So I carried on, but made sure I always put extra sun cream on the red area, which slowly got bigger. From around June 2014 right through to the new year, a gym friend of mine nagged me in a nice way, saying how much it concerned her. But even then, I thought as professionals had said it was okay, I could just ignore it. Deep down, I was concerned, but was very scared at the thought of having it removed. I'd always been very nervous of medical situations, particularly after losing my dad to cancer in 2004. In January 2015, I went to my doctor's surgery. A different doctor saw me and offered to freeze it off again, but thankfully I manned up and asked for a referral to the Lister Hospital in Stevenage. It scares me now that I could have just agreed for her to freeze it off, and I would have ended up with a much worse diagnosis. 11 days later, I had my appointment through. I was seen by Dr. Javed, who recommended removing it and described the elliptical shape of skin which would need to be removed. I felt sick at the thought of having a procedure whilst awake and left feeling terrified. 3.5 weeks later, in February, another surgeon said she'd do a punch biopsy to save me having a possibly unnecessary scar. So that's what I agreed to, thinking it can't look that bad. The biopsy results were inconclusive, so 5 weeks later in April, I had the first operation to remove the section. The surgeon, Dr. Javed, who had originally seen me, was annoyed that they had not done this procedure back in February instead of just doing a biopsy. I struggled mentally being awake during the op, but had my earphones in with very loud rock music, my eyes tight shut, and used meditation to get me through. The scar was sore but healed well, and I got quite adept at using one arm for a few days. After 3.5 agonising weeks of waiting, I phoned the Lister Hospital and was told my results were in. I went that afternoon with a feeling of dread. Another consultant, Mr. Goon, bad name really, called me in, and I noticed for the first time a nurse came in with me too, and there was a box of tissues on his desk. Regretfully and stupidly, I'd gone to this appointment alone. No one expects to hear, "I'm sorry, but it's bad news." I was told I had malignant melanoma, the worst skin cancer, and not to Google it. Suddenly I was being told that I would be assigned a Macmillan nurse, and everything felt surreal, like you're watching a play, as if it's not really happening to you. I cried on the lovely nurse Caroline, who was really kind. I pulled myself together but lost it on my way out of the hospital, and I'll never forget a lovely old couple offered to sit with me and buy me a coffee. Their kindness was unexpected, and I'll never forget it. It was enormously tough telling my 4 daughters and partner, but they've been amazing. They cooked, did my hair, and made sure my nails always looked good and made me feel normal. My melanoma was measured at a depth of 0.9 millimetres, and I would need a sentinel lymph node biopsy at the Royal Free Hospital in London. My case was discussed a few days later at an MDT meeting, where there were some questions over the results. I had to wait another agonising week for my melanoma to be examined in more detail by more specialists. My Macmillan nurse Veronica phoned me to tell me that it's been remeasured at 0.5 and no biopsy would be needed. I cried with relief. This was a difficult and eye-opening time, as a couple of close friends disappeared out of my life. I can only imagine that for whatever reason, they didn't want to know or be involved. Via Facebook, I discovered the Melanoma Mates page, where I received a really warm welcome, and it was very informative. Through this page, I met my arm twin, Lindsay. She had the exact diagnosis on the same arm as me, and her operations were at the same time too. Between us, we set up a group for stage 1 and 2 melanoma patients in the UK. This group now has 142 members, and it'd be great if any of you would like to join or know people who'd benefit from belonging to this early stage group. A few days later, my partner Graham and I went to Rome with a couple of friends, which, although enjoyable, I was terrified of the sun. I spent most of my week searching for shade and remember feeling really nervous sitting in an open-top bus, unable to find shade. Mentally, this time was really hard. My friend kept saying how pale she was and that she wanted to go down to the beach to sunbathe. I felt hurt by her lack of understanding and empathy, thinking some people just won't learn. 5 weeks after my diagnosis, I was back to Lister Hospital and thankfully sedated for my wide local excision. Mr. Goon and all the staff were absolutely amazing. He did a flap on my arm and bandaged me tightly for 3 weeks, so I'm left with a pretty decent-looking scar and some numbness, which sometimes causes awkwardness when people ask about it. As soon as you mention the word cancer, they tend to look very uncomfortable, but often it's an opportunity to talk about melanoma and spread awareness. A few friends have had moles checked out since and removed, but thankfully they've all been benign. On July the 14th last year, I got the all clear, and that would have been my lovely dad's birthday, so he's up there somewhere looking out for me. Once I got this good news, I decided to question the doctor's original recommendation to freeze the lesion off again. I had a meeting with the doctor who'd seen me, the head of practice and the practice manager, to stress the importance of doctor training regarding skin, and that if they're in any doubt, patients should be referred. It's good to know the NICE guidelines are now in place. I appreciate doctors can't specialise in everything, but they just shouldn't take chances. My first 3 months check at the hospital was very brief, and I was worried about being examined thoroughly, so I'm now being cared for and checked by Dr. Mazam in Hertford. He's photographed a few possible problem moles and also removed a basal cell carcinoma by my eye, which has left no scar. He also arranged a blood test to measure my vitamin D level, and I take a supplement daily. I've also upped my exercise, particularly cardio, but don't do as much as Mel. And try to eat a clean diet with as little processed sugar as possible. This has actually gone out the window today because I've eaten and drunk everything. This summer sees me in a much better place mentally, and I can even hang the washing out without total panic and fear. I have a bit of early sun in the morning and late evening and love it again. And the rest of the time, I'm factor 50 all the way. A positive was my Macmillan nurse who put me forward to be a patient rep on the hospital board. I'm really pleased to be able to put across the patient's view at the meetings, and I think it's great that we have a say in our care and treatment. Melanoma has brought some awesome people into my life who have given me so much support. Some are here tonight, and I know that they'll be friends for life. While I have a captive audience, I'd like to tell another story very briefly. My partner Graham, who sat there in the black t-shirt, who came up to surprise me tonight, was diagnosed aged 49 with prostate cancer 6 months ago, just before Christmas. He just had to get in and steal my thunder. He's very fit and runs marathons and had no symptoms. This made me realise how difficult it is and how helpless you feel watching someone you love go through cancer. So all you ladies, get any men in your life to get the simple blood test. And all you men, don't put it off. Graham had the operation in February and is back at work and building up to his marathons again. Thank you everyone for listening. I hope you got something from my story.